There's been plenty of research on the topic in the US, Great Britain, and Australia, most showing benefits of having nurse practitioners in the emergency. Some of these benefits include shorter wait times, less people who leave without being seen because of the waits being too long, greater department flow and subsequent greater number of patients seen in a 24-hour period, and overall decreased healthcare costs. Unfortunately, there's been very little research done in Canada, cue my master's research project, which I'm here to talk to you about today, the impact of emergency nurse practitioners on healthcare outcomes in Canada. As a quick reminder of what healthcare outcomes are, they are data that are collected which tracks improvements to health status. So examples of that would include length of stay in the hospital, 30-day survival post-heart attack, or the percentage of patients who got infected after surgery. Canada has a whopping total of 5 research articles that met the criteria for my paper last year. Just 5. Of the 5, 2 were in Alberta, one that was more than 10 years old, and one that was out of Strathcona just recently in 2020. So in this paper, I compared the results of the 5 articles, summarized them, and in the end, left recommendations that we definitely need more research on the topic. So what evidence did I find? The Canadian Association of Emergency Physicians came out with an article in 2013 talking about emergency department overcrowding and patient access to care. Their opening remark in that article was, overcrowding has been an issue in Canada for over 20 years. So what did they do? They released a benchmark to track how severe the actual problem is. With this benchmark, they suggested ideal times to get seen according to how sick the patient was. Patients seen by a nurse practitioner during their emergency visit were 2.1 times more likely to meet the benchmark set by the Canadian Association of Emergency Physicians than those who were not seen by a nurse practitioner. If a nurse practitioner was present in the department but did not actually see the patient, that patient was still 1.5 times more likely to meet the benchmark set. So what does that mean for us? Well, it means exactly what the last point in the column says, reduced wait times for patients who come to the emergency department. One of the articles summarized showed a 48.8% reduction in emergency length of stay. Their numbers showed a reduction from 4 hours and 16 minutes down to 2 hours and 11 minutes, which is pretty much the time being cut in half. The article summaries showed a 29% reduction in the number of patients who left without being seen, which happens more often than you may think. A decrease in the total number of revisit rates in a 72-hour period, meaning that within 3 days after being in the emergency department, the patients returned less often for the same issue. There was an increase of total of 12% patient throughput per shift, meaning that they were able to care for 12% more patients throughout the day when a nurse practitioner was present. And lastly, more available time to follow up with patients in an outpatient setting. Having nurse practitioners present created more time for physicians and nurse practitioners to call patients with results, telling them they need to come back to the emergency, go to their family doctor, or just pop on over to their closest pharmacy to get the prescription that was going to get faxed. There was a 72.5% of patients who visited the emergency were happy to see a nurse practitioner. You might think, well, what about the other 27.5%? Well, not everyone actually knows what a nurse practitioner does or how they can help. So my hope, after today, is that all of you have a better understanding of how my colleagues and I can improve your care, make you more comfortable, and decrease healthcare costs. A survey that one of the researchers performed showed high rates of satisfaction among patients who were cared for by a nurse practitioner. ARNET support. They supported me financially through my entire 2 years of my master's degree. Dropping down to a single income to pursue my degree full-time would have been pretty much impossible without their support. If I had to work part-time, I would have had to extend the master's degree an additional 2 years, which would have made my wife very unhappy. That goes for some of my friends and colleagues as well. Thanks to their support, I had a much less stressful time focusing on my studies, all the while preparing for baby Damien to join the family.